UWS from Alexandria, Virginia.
Welcome to UWS from Eugene, Oregon.
Welcome to UWS from Boston, Massachusetts.
Welcome to UWS from Alberta, Canada.
Welcome to UWS from Iran.
Good morning, and thank you so much for joining us. My name is Natasha French, and I'm the Assistant Director of Admissions and International Student Advisor here at the University of Western States. Our event today will include a presentation by the Dean of the Chiropractic College, student interviews with an attending physician from our campus health center and a member of our chiropractic faculty, a Q&A panel with current students and alumni. Finally, we'll end with an overview of the admissions requirements and then open the floor to all of the questions that you might have for our panelists. If you would like to ask a question during the student and alumni panel or during the final Q&A, simply click on the Q&A button at the bottom of your screen and then toggle to choose whether you would like the question to include your name or be posted anonymously. We'll answer as many questions as the time allows and then respond to others via email to everyone who RSVP'd. We hope you enjoy the event. I'm excited to introduce our first speaker, your Dean of the Chiropractic College, Dr. Kathleen Galligan.
Hi, I'm Dr. Kathleen Galligan, Dean of the College of Chiropractic at the University of Western States, and I'm here to welcome you to the Doctor of Chiropractic degree program. I can tell you that after 37 years of private practice, this is an excellent and exciting profession, and we are here to guide you through your journey. The chiropractic program at the University of Western States is a 12-quarter program, and most students complete the program in 3 to 4 years. To be successful in this program, you have to come in with a strong basic science background because our program is quite rigorous. You also have to have a passion for people. As you move through the clinical phase, you'll be using your knowledge to engage with people. You have to be a good listener. You have to be empathetic so that you can pay attention and work with your patient in developing their care plans. The University of Western States has long been a leader in using evidence-informed practice, and the methods involved in evidence-informed practice are woven throughout our curriculum so that the students learn how to evaluate and use the best evidence that's out there as they evaluate information and inform their patient care. Students in our chiropractic program have multiple clinical opportunities. We have a large on-site clinic on the campus. We have multiple off-site clinics around the Portland metropolitan area that serve the underserved communities. We place students at multiple VA sites across the country. We have a community-based internship program where students are placed in private practices, and close to the end of their time in the clinic, students can return home and participate with a preceptor doctor.
Thank you, Dr. Galligan. Next up, we have current student Caitlin Jones interviewing one of our chiropractic faculty, Dr. Kate Brown.
Yeah, so for those that don't know, I'm with Dr. Brown today. My name is Caitlin Jones. I'm a quarter 9 student, and I am studying for my Doctor of Chiropractic degree as well as my master's in sports medicine. My favorite class with Dr. Brown is one that she co-taught with Dr. Nordine, which is head and neck, which going into school, I didn't think I would learn any of that. But a lot of the different adjustments that we learn, as well as the exams, like how to fix vertigo and treat that, is something that I never really thought that we would learn. And it was really, really fun and interesting. So, Dr. Brown, what led you to become a chiropractor and what continues to motivate you?
Hi, yeah, well, I have 3 uncles and an aunt that are all chiropractors, and it was always kind of in the back of my mind as something to do. And I've always loved chiropractic, and I watched my family members love chiropractic and love what they do, and they always seemed happy and they had great lifestyles. So after college, I found myself working at a job that I didn't love at all. I didn't like very much. I had very little freedom in my schedule and in my life. And that kind of pushed me towards going to chiropractic school. And I'm really happy to say that I'm thrilled with my career choice and I love being a chiropractor.
That's wonderful. Yeah. So what do you love about being a chiropractor?
I think it's a lot the instant gratification. So a patient can come into my office and maybe they have been in pain or have been dealing with some health issue or something for weeks or months or even years sometimes. And within 20 minutes, there's a significant improvement and we've changed their life. So there's little miracles or, you know, little magic that happens in the office all the time. And people are so grateful. And getting to connect with patients and make a difference in people's lives. It's a really gratifying, and I love going to work.
Well, as a future chiropractor, I'm very excited to hear that. As it gives me something to look forward to and to keep on the list to be excited about.
That's awesome.
So what courses do you teach at UWS?
I teach courses all over the curriculum, starting in second year with the course that you mentioned, that head and neck physical diagnosis lab. I teach documentation and charting courses. I also teach pediatrics and a course called Clinically Applied Evidence, which is one of the last courses taught in the program before graduation. Students use the skills and knowledge that they've learned all through the program to look at research and inform kind of how they see patients, what treatments they might do, and maybe some advice to give their patients based on the best research.
Nice. Well, I'm excited and looking forward to that class.
Yeah.
So out of all those classes, which one is your favorite and why?
My favorite is definitely the one that you mentioned, that head and neck class. It is so much fun. We get to learn some really awesome treatments for the sinuses and for the ears, things that I'm really passionate about in practice and I feel really excited about. We have a good time in that class.
Absolutely. Like, honestly, I never truly understood the sinuses until we did the balloon technique. And I was like, oh, that's what those are?
That's probably my favorite thing to teach of anything, the whole curriculum.
Absolutely. I'm just happy that I was okay having balloons in my nose, that it was a fun technique.
Don't spoil the surprise.
Sorry. So since a lot of people who are attending the session are just starting to research the difference in chiropractic programs, can you describe what makes UWS unique?
Yeah, I'm really proud to be part of the community here. I think we have a really special program. We all work together really, really well, and our curriculum sets students up to be confident doctors that can effectively diagnose and treat and use the best evidence for the patients. And not least importantly, we're also in Portland, which is such an awesome place to live. We have amazing food and amazing outdoor activities. We have the mountains nearby, we have the ocean nearby. It's beautiful here. And despite what you might have heard, that we actually have pretty good weather a lot of the time.
Yeah, it doesn't rain as much as I thought it would. But well, since Oregon is so unique in its scope of practice, can you talk a little bit about that and how it relates to our curriculum, as well as, such as interesting topics that you might only learn at UWS because of that?
Yeah, so we have a really wide scope of practice here in Oregon. If you're a chiropractor in Oregon, you can really do anything that a medical doctor can do, with the exception of major surgery and prescribing medications. So that makes having our campus here really fun, because we can do a lot of extra treatments like those that I was referencing earlier in that head and neck class. And I think that even if students are going back to a state where they're not allowed to perform some of those procedures, being able to get that hands-on experience helps to make them more well-rounded doctors, and it makes it easier for them to communicate with professionals in other medical fields. It's definitely a plus.
No, absolutely. I know one of the classes that we take, Clin Lab, where we learn venipuncture, which I think that's pretty unique for Oregon. Yeah. When I shadowed a naturopathic doctor the other day, who's also a chiropractor, he does most of all of his own lab work. And so it was really interesting to actually see something that we learned in practice in real life. And I was like, oh, we can do this.
Yeah.
So, yeah. As a faculty member, how do the faculty at UWS support students in the program outside of classroom hours?
Sure. So I think you probably have experienced this. If you walk down the hallway where the faculty offices are, all the faculty doors are open and you can just pop into anyone's office at any time. We're all there. And I definitely have students stop by and ask questions about their coursework or, a test or something like that. But I would say a large percentage of my interaction with students is actually them asking about future practice and maybe looking at a contract or talking about an idea that they have for setting up their own practice, or space or something like that, or they've just seen an interesting patient in the clinic and they want to kind of bounce off ideas about how to treat the patient and things like that. So we really support students in their education, but we also really support students in their future careers. And you're all going to be our colleagues someday, and we want to have the best group of colleagues possible.
Yeah, no, absolutely. I've always felt very supported by you as well as the other faculty. And it's nice because everyone has kind of like their own little niche that they have. So you can reach out to multiple different faculty members about what they specialize in. And as well as everyone has general practice experience as well.
Yeah.
So what advice would you give to someone who's preparing to start the chiropractic program?
Yeah, I would just say this program is really fun. You're going to be with a group of students all day, every day for a few years. So unlike undergrad where everybody's kind of taking their own courses, you're going to be all in the same classes all the time. So you can really make some lifelong friends. And I would just say make the most of your program, make the most of the resources that are available to you at UWS and Portland and everything that it has to offer, and go on to have a really awesome career.
Yeah, no, that's definitely great advice, and I second that. Awesome. Well, thank you so much for doing this and talking to me, Dr. Brown. It was nice meeting with you.
See you. Okay, take care.
You too.
Bye.
Thank you for that information and advice, Dr. Brown. Next up, we have current student Caitlin Jones interviewing Dr. Craig Kawaoka, an attending physician from our campus health center.
Hi there, my name is Caitlin Jones, and I'm a quarter 9 student at UWS, and I'm here talking with Dr. Kawaoka, who is a clinician at the UWS Campus Health Center. So as I mentioned, I'm in quarter 9, which means that I have a full semester working in the clinic as an intern under Dr. Armington. And so far the experience has been really awesome. I've worked with a couple of fun patients already, and just seeing everything, finally come together after being in school for 2 years is really rewarding. Leading up to getting into the clinic, the UWS trains us in the Student Assessment Center, which is wonderful because we work with standardized patients, which helps us to kind of perfect our flows, as well as decide which orthos we should do to kind of help figure out how we should approach patient care while we're in the clinic, along with our attending clinician. So again, like I said, I'm here with Dr. Kawaoka, who is a physician in the clinic. And Dr. K, can you describe your various roles since joining UWS, as well as your current role as a supervisory clinician in the health center?
Sure. When I first got to UWS, I was a clinical director of the Sports Masters program in sports medicine. And then I became a supervising clinician, like Dr. Armington, who you have. And I kind of teach some classes here and there, mostly like guest lecturers. And then I am now currently teaching a Sports Masters course.
Yes, and as a person who was in that course last quarter, it's amazing. So far, it's my favorite course that we've taken in the sports med program. So I've kind of briefly described my clinic experience so far, since I'm still very fresh. What can I, as well as other upper quarter students, expect to learn as they develop more into the program and become more of the upper quarter students in the clinic?
For us as clinicians, what we see is you guys got this vast, great knowledge from the preclinical aspect of it. Now it's up to us to help you put that together and how it flows and how it makes sense, why you do histories or why you ask these certain questions, and then why you do certain exams to either rule in or rule out between your differentials and stuff. And then what I find sometimes for some people, the biggest missing piece is, okay, I figured this out, now what do I do with it? And I think that's where we really come in and say, okay, in our clinical experiences, these are kind of things you want to look at, either soft tissue wise, adjusting wise, taping, active care. So mainly it's kind of like building this pyramid. Now we're at the top of the pyramid, and we're helping you kind of develop and get you ready for the real world.
Well, real world is exciting. So speaking of that, how prepared are new graduates for passing board exams, as well as the more important thing, joining or starting a practice?
I think you guys are really well prepared to pass boards. I think UWS does a great job of preparing you guys and getting you ready. It's more about the confidence in yourselves and kind of taking a step back and relaxing and not overthink things and stuff. As for clinical practice, I think you're like that sponge still. So we teach you some things, but the next step is learning the business part of it, learning how to interact and market yourselves. And that's going to be learned out there, but I think you're really prepared to at least start out and not stumble over your feet too often and stuff to do that. I think we do a good job of preparing you for the real world, but there's still a lot more to learn after you're done here.
Absolutely. Having only 1 year in the clinic, you definitely need to keep furthering your education.
Exactly.
Well, expanding on that, are there other clinical rotations that I can do in addition to a rotation in the campus health center to help, get more experience?
I think any experience you can gain whatsoever, whether it be in private practice, some sporting events, and in your case, because you're in the sports master's program, any experience that you can get is beneficial, whether it's good or bad, or there's no good or bad, but just learning experience that, yeah, those are things I like, or maybe I won't do it that way, maybe I'll do it this way. But anything you can get will help you, enhance you as you get further down the line. Remember, even when you're done and graduated, your learning doesn't stop. You continue to learn because you see different things. Even me, I've been doing this for a long time. I'm still learning, and I love that opportunity to continue to learn because, I didn't think about that way. Oh, that's a good way of looking at it. Oh, that's a good question. I think that's just keep an open mind and just want to learn.
Yeah, absolutely. Well, what are some of the most interesting cases that you and subsequently students working under you have had the opportunity to diagnose and treat?
Wow. With students underneath me, okay, that's going to be a tough one. Like in sporting events, we go back to those. We see a lot of trauma. So we've seen some dislocations of shoulders, ankles. We've seen concussions that don't seem like really serious, but then all of a sudden the athlete becomes very disoriented and stuff. So just being in that atmosphere and seeing people's eyes being this wide when they see those things, but you have to be the calm demeanor and think through it to get the person into the right atmosphere or the right situation. Those are things, and to know that that person or athlete came back healthy and that they were fine, that there was no serious complications. Those are some of the things. Most of the stuff in clinic, I think more exciting for students is when they get an acute low back pain patient or acute neck patient. They're like, what do I do with this person? Everything I do will touch and it's going to hurt them. And then realize by being calm, doing the things that you do know how to do, I'll bet you may not be aggressive with them, but you can really help the patient. I think that's an epiphany for students. I think anything you get right now is a good, interesting case for students.
Absolutely. Like, even that we learn so much from the Student Assessment Center, working with an actual patient who has real symptoms is definitely rewarding. And you actually really do learn on the fly of what you actually do with an acute patient, which is exactly nice with your help.
You don't have students that you work on who know exactly what you're doing and what you're going to ask. Now you have people that don't know that and go, okay, well, can you really help me? So, those, I think anything in the clinic is a learning experience.
Absolutely. Well, touching on the sports med program, is there a benefit to completing the sports med master's program alongside of the DC program?
I think for some it is very beneficial, especially the more that you're out there, and you volunteer for those times and get out there and get experience, because those are experiences that you may not get for years down the line. I mean, you may see some of the things, but it's kind of like a compacted time limit that you get to see these things. And you're also under somebody's supervision who's maybe seen some of these things and can guide you through those. I think, and again, just like we talked about earlier, any clinical experience whatsoever is beneficial to you. But again, you have to be that open book. You have to be willing to want to learn and be exposed to that. If you're not, then it may not be as beneficial to you.
Yeah, no, absolutely. And something that I really liked about the program was, especially with last quarter with the advanced sports medicine course going on lower extremity, was in the DC program, we learned so much with the orthos and the diagnosis, but I felt like that course really helped tie it all together and had a lot more repetition. So learning lower extremity became a lot easier because of that repetition with that course.
Oh, so, good to hear that.
Yeah. And then lastly, what can students do to become better student clinicians and help to improve patient outcomes?
I think, again, it's just one of those things, the willingness to learn and willingness to listen and know that you don't know the answers yet, and don't feel frustrated if something doesn't go right, because it's a learning experience. And just work on your flows and how you can improve on your history taking. And it's just more about putting things together and understanding how everything works and how questions work and how they go into the examination component of it. Just putting it all together is the best way you can do that, and just being an open book and be willing to say, oh, I can get rid of some of these things that I did. Now I can just fine tune it down to this little few questions or few exams that will be helpful, but understanding that, oh, maybe I need to go a little further because, oh, this is a little different than I thought what it was, and then be able to go that direction as well. But again, just having the willingness and open-mindedness to learn and just add to your repertoire would be good.
Yeah, absolutely. Like, I've known a number of students who've done a lot of shadowing, as well as talk to other clinicians, not just the one that they're work under or even are treated under, but also reaching out to other clinicians in the health center have been really helpful. And just like, as you mentioned, being open-minded and really just seeing what else is out there. So.
Exactly, because in the end, you become a mixture of all the people that you've run into, you learn from, and those kind of things, where each clinician there kind of practices a little differently, and there's nothing wrong with that. I think that's a great experience for you guys, because then you get to see different perspectives and stuff. There's no right or wrong. It's just a different way of looking at things. Yeah. You got to take advantage of that while you're still here.
Absolutely. All right. Well, thank you so much for answering all these questions, and thank you.
No, thank you. Thank you for having me. And to those, well, welcome to UWS, I hope.
Thank you for those insights into the clinic experience, Dr. Kaoka. Next, I'd like to introduce our student and alumni panel. Let's start things off with each of you introducing yourselves, including your name, where you're from, and what clinic you're currently working in. Caitlin, would you like to start us off?
Sure. My name is Caitlin Jones. I'm a current quarter 9 student, so I'm working in the UWS Health Center clinic as a student.
Great. And Dr. Masumi? Oops, your volume's off.
Can you hear me now? So yeah, my name is Masumi. I'm a chiropractor in Vancouver, in Canada. I graduated from chiropractic school in 2010. I went back after a few years, did my master's degree in sports medicine. And after that, I enrolled in our 4-year fellowship in Canada for sports residency. So in order to be a sports specialist in Canada, you have to do 4 more years of school after your DC. So I'm in that one. And I practice in Vancouver, in downtown Vancouver. Just opened up a clinic literally June 1st, right after COVID. So perfect timing to open up a clinic. It's been doing pretty good, actually, so it's not too bad. And I'm a team chiropractor for UBC hockey team. I've worked with I was a chiropractor for the World Juniors, WIHF World Juniors. I've done lacrosse World Cup, softball World Cup, PGA golf. So I've done a lot of different teams, and currently I'm the chiropractor. I'm a referring chiropractor from UBC Athletic Department. So everyone in the University of British Columbia, if they need a second opinion for sports medicine, chiro, they usually come to my downtown clinic. So.
Great, thank you. Dr. Andres, what about you?
Hi, how is everyone?
Good.
My name is Dr. Montserrat Andres, and I am also a sports chiropractor. I work at Evolution Healthcare and Fitness, which is a interdisciplinary sports medicine practice. And I'm a dancer, and so I specialize in treating artists.
Great, thank you. And what about you, Dr. Agape?
Hello, everybody. My name is Dr. Byron Agape. I'm from Hawaii, but I moved to Oregon 8 years ago now. I'm at Active Wellness Chiropractic in Beaverton. It's a family clinic, but we see a lot of pregnancy in peds. I work with a lot of youth athletes. And I'm hopefully going to get into the animal chiropractic program next year. So hopefully things are leveled out by then.
Fantastic. What about you, Jolene?
Hi everyone, I'm Q12 right now. I'm originally from Alberta, Canada. I do plan on staying in America, so I just actually got approved on my next visa, which you can do if you come down as a student, which is awesome. I'm still in the school clinic. COVID kind of took a little shift on some preceptor stuff, but yeah, graduated in a month and a half and pretty stoked.
Great, thank you. So let's go back through the same order. And if you can all answer, what inspired you to pursue a career as a doctor of chiropractic?
Yeah, so I'm a second career student, and I actually have a background in sales, which is very different than chiropractic, but you have to learn how to sell yourself, so it does kind of fit. But I used to coach CrossFit for a number of years, and I really liked helping people move better. And so I wanted a bigger hand in that, and more than just coaching people through movements. I wanted to actually get a better education to learn how to properly help people, especially since I had gone through so many injuries and my chiropractor helped me so much. Like if it weren't for him, I would probably have trouble walking still. So was definitely very inspired by my chiropractor to help people kind of like me in a background of sports be able to move better and have, more of an active lifestyle.
That's great. Dr. Masumi.
So mine is pretty simple, I guess. I was treated a few times by my sports chiropractor. I was at SFU playing soccer, and so that was one reason. I got exposed to it. Wanted to be a doctor, and I wanted to make money. That's it.
Okay. And Dr. Andres.
Yeah, this question for me is like a really long, deep question, but I come from a family of healers. So my great-grandmother was a midwife and an herbalist in Honduras, and also did a lot of soft tissue work and massage, which she then passed on to my grandmother. And so I grew up watching my grandmother treat people from our community in our house, which then led me into a career in massage therapy. And once I was in massage therapy, I realized taking a lot of continuing education classes that I wanted more. I wanted to have more autonomy, and I wanted to be able to be an advocate for people's health. And I wanted to have more of a say in helping to guide people's care and hopefully avoid surgeries and, a lot of the more aggressive things that sometimes aren't necessarily what would be our go-to first thing, but that sometimes in allopathic medicine, people get shuffled a lot faster through into that. And so I was really inspired to be able to give people different options and have an authoritative voice in being able to do that.
Great, thank you. And Dr. Agape.
Yeah, when I was in college, I really didn't have too much of a plan for afterwards. I was just kind of going through the biology program. I was actually specialized in marine ecology and marine life. So I was just kind of going through the lab series. I was in a weightlifting program, and I had hurt my back really bad, and I barely could walk out of the room. So coach told me, hey, maybe you should go visit the chiropractor down the road, Dr. Joint, which, was kind of fitting. And that was my very first chiropractic experience. I didn't know what to expect. I just kind of went in there hoping to get out of acute pain. And he told me everything that he was going to do. And when he went to adjust my low back, I guess it was so relieving and so sudden that he made me fart really loud. He laughed, the receptionist laughed, I laughed. And so we got really close from that experience. I got to ask a lot of questions, and because we were so close, he just kind of like facilitated that type of education, encouraged me to check out the field. I did, and more and more I became very interested in chiropractic. And so he encouraged me to apply to whatever programs aligned with my philosophy. And later on, the year after that, I was at UWS, and now I'm here.
I'm so glad that you ended up coming. So our next question, I'm just going to open it up to anyone to answer. What did you most enjoy about attending UWS?
I think my favorite part of it has been coming from my undergrad. I was at a smaller school, and so it was kind of, everybody was close, but it was different. When I came to UWS, you really are a family there, because you think about chiropractors, a lot of us are very outgoing. You have to be to work with people. And so it was like taking a bunch of outgoing people, putting us in one place. And everybody at this point has like the same career path. We're all interested in very similar stuff. And so it's really cool to be able to have this similar group of people together. And on top of that, the staff and faculty members are honestly so welcoming and want to help you in any way, shape, or form. I actually have my Part 4 boards in like 7 days now, which is the big one. And since we're all online, we haven't got as much review as they would have been given in the past. So a lot of professors have gone out of the way to make online reviews available to us. And then whenever we have questions, they're like getting back to us within the day, which has been really awesome.
That's so good to hear. Does anyone else have anything that they want to share?
I think also for me, it was very similar. It was definitely the faculty plays a major, major role in my fond memories of UWS. From the moment I landed and was in my first classes, the first day, I was like, all right, this is going to be really hard and also really good. And I think that it's one of the reasons that I chose to go to the school. And definitely one of the things that I continue to hold with me as a big plus for the program.
Great, thank you.
I can add to that. It's for me was honestly, if you want an evidence-based education, this is it. Like, this is the university to attend. And the biggest thing was when I graduated, I was pretty ready. So those are the main facts and main things that I liked about it. Obviously, like, you had the community, the sense of like friendship, you make a lot of friends, all that stuff. I mean, I'm sure it happens with other colleges and universities as well too, but and that's 100% true. I partied a lot when I was there. So, but it was good education. It's evidence-based education. That's what I care about most. And I was pretty ready for the challenges out there. So.
I'm so glad to hear that.
The resources that UWS provided was incredible. You're continuously using all of the resources, and everyone's helping facilitate a very fun community that helps kind of further our field. So that was really good. And to go off of everyone, the community was great with Dr. Masumi. Also, definitely to blow off some steam after some exams. So the community there is very fun.
Fantastic. After all that, were there any student clubs that anyone recommends our prospective students joining if they decide to attend UWS?
Yeah, I don't know what's there still. For me, I know, I would just say, regardless of the clubs, get your body into open labs and ask a lot of questions and get your hands on different bodies. And I know I had a friend of mine that was huge. He was 6'2", he was a baseball player, and he would make me adjust him every day because I barely clear 5'2". And he was like, you are going to have to be good at this. When people come and see you, the first thing that they're going to think is this little person is not going to be able to adjust me. And so he really forced me every day. He would get all of the biggest, tallest people in our class and other people in open lab to get my confidence up, because he knew that I could do it, you know, but he was like, I want you to walk into a room and have it not even be a second thought for you. And that was really helpful. And so I think whatever your either actual or perceived weaknesses are, get into the clubs or get yourself into the situations that are going to challenge that. Like, don't wait until you're out of school. The academic environment is a nurturing environment where that is the place to make your mistakes and ask your questions and have really years and years of experience to support and help you. So whatever clubs are available that suit those needs, I say just make the time and go for it, because you will not be able to once you're done with the program.
I just want to play off that a little bit, since we had a question about it in the Q&A area. My wife is actually going through the program as well, and she is very small. She's like 5 foot, 5'1", like 100 pounds. And so for her, for any of us women even, it's a lot harder to get the adjustment, but it's not impossible. We just have to be more on top of it. The adjustments have to be more perfect in a sense. That tension really has to get there. Where when guys have a little bigger, it's easier to just use that body weight just to drop through it without having to be perfect. But it's not impossible. It may take a little harder work, but again, not impossible. And as for the clubs and stuff, MPI is really big presence on campus. It's just they have seminars and whatnot for adjusting, and those are the seminars that I chose to attend. I've done 3 of them, and they give you a different view of adjusting from the school, from what you learn in school. And it's all these seminars will give you, any person that teaches you gives you just that much of a different view, and they may say something that clicks for you. But definitely getting out and learning from as many people as possible in school is the best. And I know you hear seminar and you think about how much money we already spend on school. They do give student discounts versus when you're actually a doctor, because it's basically continuing ed stuff. But as a student, it's totally worth it. Any more education you can get as a student is totally worth it. It'll help you in the long run.
That's an excellent point. Thank you so much, Jolene.
Natasha, do you want us to answer some of those questions that are coming up on the chat, or that's for the end?
Yeah, so we can go ahead and start answering some of those since we're getting close to our end of our time. So let me read some of them off to you. Let's see, what is one for your panel? What is the average age range of a DC student?
I would say our class, we were probably like mid-20s. I'd say we definitely have like the higher 20s, low 30s, mid 30s age, and then everywhere till, like, I'm probably the youngest one in my class because I went straight through, and I just turned 25, and I graduate in a month and a half.
Yeah, my class is pretty much the same. We're all either late 20s, early 30s. I was the youngest one in my class when I graduated. I turned 25 on the day of graduation. And so if that gives you any perspective, and I came right after college too, as a good chunk did, but there were a good group of people who kind of had a little bit of job time in between.
Great. One of our next questions is specifically for Dr. Masumi. Can you clarify the requirements in Canada to be able to be a sports team chiropractor?
So for professional teams, you have to be a sports specialist. So you have to have that designation. So you can't be a regular chiropractor with a master's degree. You have to be, because, okay, well, in Canada, if you can call yourself a sports specialist chiropractor, if you have if you're a fellow of Royal College of Chiropractic Sports Sciences, so you need a designation, which is FRCCSS, to be able to be a team chiropractor for professional teams and Olympics. That's a requirement. But with, like, say, local team, whatnot, you can be a chiropractor. And you can say, I'm a chiropractor, I like treating sports injuries, but you can't call yourself a sports specialist chiropractor. So.
And so were you able to work with teams when you just had the master's degree?
I did, and actually that's where all started from for me, because with the master's program, and I love the master's program. And first of all, I'm not getting paid by UWS. I'm not on, I should be, but I'm not. But the master's program really helped me. It opened a lot of doors for me. So from that, because we had to do about 50 hours, I believe, at that time of field work, that allowed me to kind of volunteer for some teams. And from that, I actually got into UBC and with all the teams that I've been working with. So master's program really helped me generally. But say, for example, for the chiropractic, the fellowship, the sports fellowship, you have to do 1,000 hours of field work versus 50 in the masters. And there's papers you have to write and 12 courses. You have to do hospital rounds. There's a bunch of requirements that you need to do within that 4 years, basically.
Okay, thank you so much.
But everyone can message me later on if they want. I'm all open to chat. So.
Thank you, Dr. Masumi. To everyone, what made you choose chiropractic school over medical school? And what was the deciding factor to wanting to be a chiropractor as opposed to a medical doctor?
So for me, I had kind of explored medical doctor, dentistry, and chiropractic through high school. And when I was in high school, I talked to my PCP, and he basically said, like, he laid out kind of he asked me what I wanted in life. And I said, like, I want that family life. I want to be home around the table, because I didn't really have that growing up. And so he basically talked to me and said, like, this may not be your right path. So then I focused more on dentistry and chiropractic. And as soon as I was able to take the dollar signs away, it was obvious that I was too outgoing to be a dentist. I'd be that dentist, like, talking while my hands were in your mouth. So it's kind of like what led me towards chiropractic, and wouldn't change it.
Okay. Anyone else?
For me, I like almost the instant gratification you get with an adjustment and that relief you get. Of course, that's not all the time, but I like being able to get hands-on with people and giving them tools to teach them and for them to learn and not have to come back to me and be dependent on me. So that was really interesting to get into. I did look at med school. I also looked at vet school. And at the end of the day, I wanted to be hands-on with people and have that one-on-one connection with them.
Great, thank you. I have one more question that's about the Canadian Chiropractic Board exams. How challenging were they to write? And yeah, I guess, I don't know if Jolene's taken them. I believe Dr. Masumi.
I haven't taken them. I'm probably one of the only Canadians that have gone to this school, not taken any Canadian ones. I went to undergrad in America as well, and I just married my American wife, so we're planning to stay. So I knew I was going to stay, so I didn't take them. But what I've heard and how it kind of works is a lot of Canadians will take Part 1 American boards because it is within that first year of school, where the first part of Canadian boards is until the second year of school. And you just want to leave your options open. There are 4 boards for America, only 3 for Canada. They're very similarly laid out. The first board in America is all the basic science stuff, which is probably the hardest one. Like, it is difficult. The Canadian one has some of the basic science stuff, but also it focuses more on the actual conditions and treatment of like that type of stuff. But I've heard that the Canadian ones, people who have taken both say that the Canadian ones and the American ones are very similar.
I took the first and second part of the US one. I mean, just to put in perspective, I studied for those ones maybe, I don't know, 2 weeks, if I remember correctly. For the Canadian one was about 3 months that I had to study for it. But you'll pass. Like, I mean, it's not a big, that should not be a factor for if you want to attend the school in States. I mean, it depends on what school, because yeah, if some schools in States you attended, good luck, right? And but it's doable. I wasn't the smartest student really when I was at UWS. I wasn't all like, you know, A's or whatnot. So I did it, and anyone else can do it. It's just, yeah, you have to study for it. You have to put a couple months for it, but it's 100% doable. So I would not even think about it. Just don't worry about it.
Okay. And for all of our alumni who are with us today, are graduates able to go right into their chiropractic career, or does it extend into more education? Were there challenges that you came across?
Yeah, I was able to go straight in. You of course have to wait for your license. And so that gap of time is dependent on when you graduate and what your finances are in terms of being able to afford to pay for all of the things that you need to do to get the license. But in terms of that for us, I graduated, I had already passed my boards. And so it was just a matter of waiting for licensure.
For me, it was pretty easy. I was offered a job the day of graduation. And my biggest tip for everyone to get into practice is to reach out and do a lot of shadowing. UWS, their curriculum involves a lot of shadowing opportunities. You know, you're under a lot of doctors. So definitely outside of that, go and be annoying, find doctors who you want to like have an idea of what kind of practice they have, and that's what you want to adapt. Reach out to them. Like, don't worry, like worst they can say is no. So reach out, try to shadow as many people as you can, and learn from that and make a lot of connections, because at that point it'd be pretty easy to roll into some kind of job.
And someone else has asked if they're required to have a science background. So if you came from a different undergraduate degree, how will you do in the program? Do you need to do anything additional to prepare yourself?
Yeah, definitely not. Go ahead, Caitlin.
I was gonna say, I came from, like I graduated from undergrad more than 10 years before I came into chiropractic school. And my undergrad was in political science, where my science was rocks for jocks. So I didn't even take a real science technically. So I had to go back to school and get all the prerequisites to apply. So one thing I would definitely recommend, take anatomy. That is gonna save you so much time and crying the first year. So I would say definitely you don't necessarily need a background in science, but being comfortable with it and taking a couple courses like anatomy and some sort of chemistry will definitely go a long way that first year.
Great. Dr. Andres?
I have my degree in dance. My undergrad is in dance. I did all of my electives as my sciences. So I still followed a pre-med track, but it was on my own time, so to speak. And so your undergrad degree does not have to be in an actual science major. But I always loved the sciences. And so I was in those classes and did well. And that it definitely served me. I don't know that I would want to begin such a heavy and intense science program without knowing the skills that you need in order to be able to study for them, because I think it takes a very particular type of mindset to study and learn sciences. So I definitely recommend having practice with it, but your actual degree does not need to be in it.
Great, thank you all so much. And to our attendees, thank you for your questions. We're now gonna add in our other panelists, the Dean and the clinical and chiropractic faculty to join us. So I'll start asking your questions to the whole group. So keep posting to the Q&A and I will start reading off some of your questions to everyone. Does UWS academics help prepare for board exams in Canada as well as the US exams?
Yes, 100%.
Okay. And regarding COVID, when will students go back to in-person learning? I think this is probably a good question for Dr. Galligan if she's with us.
Yes, I am here. Unfortunately, I'm not able to predict the pandemic any better than anybody else, but we do have in-person small group labs that we are doing because that's necessary to get through the program. And we don't at this point have any plans to stop doing that. It will be at some point during next year, we hope to have other people back on campus for lectures, but it's a little bit unpredictable right now.
Thank you. And to everyone, what is your favorite part of the new building?
Oh, I like the climate control. No, I think it's really nice. Like the clinic is, when I first saw the clinic from being the old clinic to now, I was kind of like, oh, this will be interesting. But honestly, it's turned out really great. The space overall, like having the space in the adjusting labs, because it can, in the old school, it would get really tight and hot in there. So those spaces are just like so much nicer. And there's a lot of little nooks and crannies to find your own like little private studying area, which has been nice.
There is significantly increased educational technology too. I think you see that in the adjusting labs probably, with the ability to have one instructor in one room speaking to 4 different rooms while there are people roaming around helping with the adjusting and some things like that. It's really enhanced the ability to deliver those classes.
Since classes are online, do students still need to get an iPad by the start of class? It's probably also for you, Dr. Galligan.
Well, I think how we answered that question before was that we recommended it just so they could get used to using it. But obviously I can't dictate what you have in your house. And we are running a pilot program to see if iPad is what we'll end up with ultimately, because there are in some ways a laptop is better, in other ways an iPad is better. But just because at this point, that's what's required. Once you get on campus, it's recommended that you start with that so you can be adept at using it.
So I want to add a little bit to that about the iPad stuff. I initially bought like just a cheap iPad because I knew we were just going to need it to take tests. After like a month being in the program, I was like, okay, I need to upgrade. There's an app called Notability, which you can put all of your PDF note packets on. You can write all over it. You can highlight all over it, add pictures. Everything is in it. It's like a $10 app, probably like the best $10 I've spent. And it is, I have a nice, I got a MacBook like senior year of undergrad, and I've barely used it compared to my iPad. So it's definitely something not to skimp out on. And I think you will find out you'll use it a lot more than you think you would.
I definitely agree with that. How soon into the program are students allowed to adjust? Maybe Dr. Brown?
Sure. Normally we start with the very first quarter, students are on campus and just kind of palpating, so examining and seeing the different structures. And then by the second quarter, they're practicing skills that are getting them ready to adjust. And then by the third quarter, they're adjusting. And I think now with students not being on campus, the intention is still to have them adjusting in that third quarter and kind of putting that all together at the same time, because they are going to have all that knowledge coming in.
Yeah,
the in-person labs do start in third quarter.
Yeah.
Yep.
And that's still true even during COVID right now, that students third quarter and above are coming to campus for labs.
And I know a lot of other schools start first quarter, and so some people are bummed when you don't start till the third quarter here, but honestly, you don't know what's going on first quarter. And so it's good that by third quarter, you kind of know the structures underneath the skin. So it makes it a lot easier to understand in your brain.
That's a really good point. One of the questions was, when does the application open? Applications for October 2021 are already open, so you're welcome to go ahead and apply for that start, or even this upcoming January. There's still a couple spots left. And there is no entrance exam, so no GRE or MAT required. Let's see. Since lectures are online, could a student take the first year of classes at home without moving to Portland and then move to Portland when in-person classes resume? I think this is another question for Dr. Galligan.
Yes, you can. That's the answer. You're not required to be on campus until third quarter.
So third quarter means basically about 6 months into the program. So slightly less than a year, but you do get some time at home.
I don't know what will be true in fall of 21. Could be different.
Let's see, here's a good question. What did you regret not doing earlier as part of the program? I guess this is for current students and alumni.
I regret not shadowing more. I think that's probably like one of the better things that you can do is learn from other docs. And the first year was really overwhelming for me, but I wish that I would have done a lot more shadowing, even so, just because it really does help you a lot.
I'd say I think I regret in the first year, I stuck with my a few friends for study groups. And I think it is beneficial to switch up those study groups. You're definitely, even if you're not a group studier, you're definitely going to become one in the program. So I would think just finding more people to bounce off of each other is the best.
Great. So our time is technically up for this Q&A, but I think we can definitely extend it a little bit if some of our panelists would like to stay on and answer some more questions. But if any of you need to leave, thank you so much. And I completely understand. And I hope you have a wonderful day. I know Dr. Kawoka is at a compassionate care event today, so thank you for joining us in general. Let's see. When you say there are in-person small group labs, does that apply to first quarter students? I received an email saying winter quarter 1 would be 100% online, so I just wanted to double check. Maybe Dr. Galligan?
Sure. For right now, yes, winter quarter 1 will be completely online. The small in-person labs don't start until quarter 3.
Great. Can I be in the process of completing prerequisites while applying? Yes, and I'll go over that in just a few minutes. Let's see.
Oh,
Why
I got
did you choose? Oh, sorry.
Sorry, I just read one about the Canadian visa process. So Natasha, who you guys are seeing now, is the person who deals with the Canadian students, and she does a phenomenal job. We have probably like 40 or 45% of my class was Canadians, and phenomenal job. And even afterwards, since staying, and like I mentioned earlier, that OPT visa, which if you have a student visa, you can apply for it, and allows you to work for 1 year and kind of get your stuff together to figure out what you want to do. And that process is, again, she's super helpful, there to answer every question. I don't know how many times we're on the phone with that, because it is kind of a stressful situation. But yeah, so you were in great hands with her. So definitely don't worry about any of that.
Thank you, Jolene. This is a question for all of our student and alumni. Why UWS versus other evidence-based schools?
I mean, I can start with that. For me, it was close to Vancouver. It was close to BCS. I could travel back and forth, and it's a great school. I knew about the board exams, how they get you ready for board exams, so it was a no-brainer. And if I may finish, Tim asked me how he can get in contact with me. You can just add me on Instagram if you want my first and last name all together. I'm going to ignore you for a couple of days because it's our conference coming up tomorrow, but I will reply to you after that. So just Ali Masumi, and I'll reply to you.
For me, I got accepted into many of the evidence-based programs, and then went and visited a lot of the schools. And one of the things that when I went on the school tour at UWS, what was really emphasized was the academic rigor, the commitment to student learning, the support of the students. And when I went to some of the other programs, the things that I was being sold on was that graduating there, I would have, literally the thing that I was sold is, if you leave here, you'll have $1 million practice. And it was mentioned so frequently, and it really turned me off, not because I didn't want to also have financial viability after I finished, but because what was much more important for me in a program was to be a good doctor. I wanted a space that was really going to nurture my academic experience and make me a really good diagnostician and a good provider. I know, just because I was a returning student, that if you go into your work with integrity, that you will have a business that is viable and thriving. So it really was a turnoff in some of the other programs, that it wasn't the production or the support of a strong doctor that was being moved forward. So UWS doing that in all the conversations that I had there was a big deciding factor for me.
One of the biggest things that I took when I was looking at schools, and this was from the advice of the chiropractor that adjusted me for the first time, was to look at the schools and their philosophies. All of the schools have their philosophies listed up on their website, so go and look through those. And then I narrowed it down to the top 3 schools that aligned with philosophies that I wanted to pursue. Among those was UWS and Logan. I went to go visit both of them. I like them all. The tour is very pompous, it's very like, here's what we have and everything. And the biggest difference I noticed was that the students at UWS were happy. I went to the campus that I visited. There were students playing volleyball outside. There was someone slacklining, which looked odd to me, but looked fun. And the students looked like they were having a good time. And they talked about the proximity to Mount Hood and all of the different parks. And that kind of sparked my interest because I like being outside, I like hiking. And work-life balance is very important to me. I mentioned somewhere in the Q&A that it's really easy to get up to Mount Hood to go snowboarding, skiing, just as easy as it is to go down to the coast. So that was very important for me for choosing UWS as a school.
Great, thank you.
Natasha, I got 1 more minute because my patient's about to be here. Is there anything specific for me? And also, like, again, if you want to set up for Canadian students, we can do this again. I'm all for it.
Thank you so much, Dr. Masumi. Maybe
for me, or
we will. Outside of dealing with sports medicine, does the master's degree in sports medicine allow students to gain lots of knowledge in rehabilitation? That might be a good question for you to end on.
I mean, okay, so sports medicine degree, if you like sports medicine and sports injuries, just do it. Like, I mean, it's a great course. It teaches you a lot. It opens a lot of doors. But honestly, I use my sports medicine degree to get in as a marketing tool, right? And as a way to get into university and working with the hockey team there. So not necessarily using it in a sense that, like, I was using it, but it helped, right? So it helped me go out there, look for volunteer, works. And from that, people got to know me, and someone said, hey, why don't you come to one of these rounds at UBC? And that's where it all started from. So you like sports medicine, do it. Like, it's a no-brainer, really.
Okay, thank you, Dr. Masumi. I think that's a perfect spot to end. We'll see you later.
Bye.
And Dr. Andreas, I know that you also did the sports medicine program. Did you have anything to add?
The sports medicine program was really transformative for me. I absolutely loved it. When you're in the chiropractic program, you're learning a lot of the same material, but in the master's program, it comes a little bit later, that you get to review all of your orthopedics, that you get to review your rehab, that you get to review, and also kind of condense that information. So in the regular chiropractic program, just as an example, let's say you get like, these are 10 orthopedic tests that you could do for this differential diagnosis. And in the sports program, it'd be like, all right, let's narrow it down to like 3 really, really solid ones to help speed up how you're getting this information. And so I think going back through and being able to do that was really helpful. And then also having the additional, I think we keep mentioning, like, not only shadow, but get out into the world and do as much as you can. Being in the clinical supervision, I was really happy earlier to see Dr. Kawaoka. He was so instrumental for my learning. He's just a phenomenal teacher, and just like his heart for getting information to students is unparalleled. And when you get to learn from instructors like him out in the field, and you get to see how they interact with people when they are in high trauma states, when you get to see them differentially diagnose, it really puts into focus why this is an art form. And so I think that the master's program really opens the door for the experiences with these really incredible clinicians.
Thank you so much, Dr. Andres. We have another question that's specific to housing. How did you find somewhere to live in Portland?
Go for it, Julie. Nope, you're good.
Okay. When I first came down, I kind of just did the online thing. And I remember asking Natasha specifically if there was a better area to live in versus not. And her response was, it depends on the street and what part of the street. And I was very confused because coming from Canada, most places have like, this area is not so great, this area is okay. Since living in Portland, I really see it. I mean, there's not one, like there's some areas that are definitely not as great, but it really depends on where you are on the street. So it's really hard to just to say. My recommendation would be, if you're looking online and you're trying to find schooling, send it to whoever your admission advisor is. Say, hey, this is the place I'm looking at. Has students stayed there before? Is this an okay area? There's also the neighborhood where the old school used to be in. There's a lot of students that live in houses here, which is where I am. And so there's always a lot of houses. And I know the new location, there's also a lot of houses around. I know you guys get put into a Facebook group. That's a big area to find roommates to live with to get a house, which if you can do it, it's probably your cheaper option, getting 3 or 4 people together to rent a house. But there's also apartment options.
When I was moving to Portland, I was coming all the way down south from Salem. I realized that Portland was very expensive. You don't really get much for your money if you're looking for like a single house. So I looked across the river in Vancouver, Washington, and I ended up choosing an apartment there because it was more affordable. You get more square footage. I had 3 rascally chihuahuas at the time, and they would allow me to bring my house. And so you just get more for your money in Vancouver. Utilities are a little bit cheaper, and the commute's not horrible. You run into a little bit of traffic, but you just have to come over the bridge. And the new school now is in a very good location to just hop off the interstate to get on. So not too bad at all. I would suggest living there if you can't find many options in Portland.
Yeah, and I'll just add that anyone can go to portlandmaps.com, which is a city government website, and look up any property and determine the crime stats for that specific property. So again, it's a government organization website. It's really helpful as you're looking to figure out the best spot to live. Let's see.
It's also very relative depending on where you lived before.
That's a really good point.
Yeah, I think there's, you know, I heard people being like, oh, the bad neighborhood in Portland, and I was like, you know, but PadMapper is also really great, a great resource to finding apartments and houses near the school. So because you can look at everything in relationship on the map, and so it can help you, like maybe something seems a little bit farther, but it's right by a train line or right by the expressway, and so then that would reduce the actual like time for you to get to school, whereas something might seem physically closer but is harder to navigate to get up to it. So I would recommend definitely mapping everything out.
Thank you. And Byron, it looks like someone specifically said that their audio cut out and they were wondering what area you named, and if you could say it again.
Yes, I lived across the river in Vancouver, Washington. I lived right off of Mill Plain Boulevard, and it was really easy. It took me, 12 minutes to get to campus? Mm-hmm.
Great.
Vancouver, Washington, sorry, not Vancouver, Canada. I don't know if that's obvious, but.
So the last question I have for everybody, would you be able to take 2 concurrent master's programs during your time at UWS?
I wouldn't recommend it, would not recommend it.
Recommend it. I would say that out of a class of, let's say 100 students, you know, a large percentage of them are doing 1 master's program and succeeding at that. And I would say maybe 2 or 3 of them could pile on another one and still be successful, but I think that would be really unusual.
Yeah. It's a very rigorous program. You would be putting yourself, I think, at a pretty significant disadvantage.
And I think another look at that too is when you finish school and let's say you did 1 master's and you want another one, that can go towards like continuing education credit when you actually are a chiropractor. So don't bombard yourself with a lot. It's a big experience. It's a big change in your life, especially if you aren't coming straight from undergrad. If you've been working for a while, like it is, if you make it through the program without being on the floor and crying, I would be very, very impressed. All of us have at least had that happen at least one time. So it's definitely very emotionally taxing and draining.
Yeah, I know generally from admissions, we recommend people looking at the DC program as a full-time job. So if you feel like you can add on a master's program with that full-time job, great, but 2 masters might be a bit tricky. And except for the sports medicine one, the others are entirely online, so you can definitely wait until you're in practice. Thank you to everyone. It looks like that's all the time that we have for questions. So I'd like to say a huge thank you to our panelists that joined us today. It's been so wonderful to have you. And thank you to our attendees for such wonderful questions. We'll try to answer the rest via email to everyone who posted a question. And now we'll talk about the prerequisites. I hope you all enjoyed getting to know our current students and alumni. Next up, we'll be talking about the admissions requirements for the program. The prerequisites for the program include a minimum of 90 semester, 135 quarter credits, a cumulative GPA of 3.0 on a 4.0 scale. The 90 semester, 135 quarter credits should represent 3 years of study toward a 4-year degree. Basic science requirements are that all of your science classes must be 100 level science or above, so no high school level coursework. You'll need 24 semester or 36 quarter credits in the sciences, and half of those classes must include a laboratory. We highly recommend 200 level science courses or above full year sequences of each science, 4 science major courses, and pre-medical or pre-health tracks. For biology, we accept general biology with labs. These include cellular biology, microbiology, etc. Additionally, we accept anatomy and physiology with labs or a combination of any of the above. For general chemistry, we would like to see a general chemistry series with lab and organic chemistry series with lab or biochemistry, which is actually the preferred course. For physics and related studies, we would like to see general physics series with a lab. This is an algebra or trigonometry-based physics series. And then biomechanics, statistics, exercise physiology, or kinesiology can also fulfill this subject area. For the humanities and social sciences, we like to see a well-rounded applicant whose background includes writing, English, speech communication, sociology, or psychology. Additional notes, students can earn their Bachelor of Science in Human Biology after the first 5 quarters in the chiropractic program. No additional coursework is required. Students must have a bachelor's degree if they're planning to apply for a master's level program that we offer. So if you're considering the master's in sports medicine or the master's in human nutrition and functional medicine and did not enter the program with a bachelor's degree, please make sure to apply for the bachelor's degree from UWS after 5th quarter. And students can apply to the Doctor of Chiropractic program before finishing their prerequisite requirements. Ready to apply? You'll want to schedule an advising appointment with an admissions advisor and then complete the online application with a $50 application fee. It'll include 2 essay questions of 250 to 500 words each. The first one is about your career goals, and the second is about extracurricular and volunteer activities you've participated in and what you've learned from them. You'll need 2 letters of recommendation and then a resume or a CV. Additionally, you'll need to provide official transcripts from all regionally accredited colleges or universities that you've attended, even if you've only taken a single course there. Once your application is submitted, we'll invite you to schedule a personal interview via Zoom. And then if you're accepted to the program, you'll need to submit a $300 tuition deposit to hold your spot. And that full amount will be applied to your first quarter tuition in the program. And then you'll also need to complete a background check. UWS does allow for financial aid, so if you're interested in applying, US students can apply for federal financial aid by submitting a FAFSA using the UWS school code 012309. Canadian students can apply for loans and grants to their province by entering UWS school code MWLM and program code TA17. There are multiple scholarships for Doctor of Chiropractic applicants on our website, so please go ahead and apply for any that you're eligible for. You can apply for up to 2. And if you have questions, you can contact our financial aid office at finaid@uws.edu or 503-847-2563. As with every institution, UWS is helping our students and employees stay safe during COVID-19. So we're actively implementing increased sanitation and prevention protocols across campus and encouraging measures to provide social distancing among students and employees, including encouraging social distancing measures when on campus, canceling non-essential travel, delaying or canceling non-essential meetings and events, transitioning essential meetings to phone, Zoom, or Microsoft Teams when possible and applicable. For upper quarter students, lectures have been moved online and labs are performed in small groups, usually with people's housemates. And then we've transitioned all first term courses and labs online. So if you were to start the program in January, your entire first term would be online. There's increased sanitation and daily cleanings on campus. If you'd like more information, please feel free to check out our website, www.uws.edu/coronavirus-resources. Will extensions be allowed for final transcripts and other application materials? This is a common question that we receive. We will be flexible and work closely with students and institutions to ensure we have documents we need without creating additional stress. We know that this has been a struggle for a number of schools to provide transcripts in a timely way. Another question, my current school closed. Will you accept an unofficial transcript? We can accept unofficial transcripts to make preliminary decisions, but final decisions regarding enrollment at UWS are contingent upon receipt of an official transcript. Are you processing applications? Yes, the admissions office is still processing applications, conducting admissions interviews, and notifying students about their admission decisions as normal. Please contact your admissions advisor directly if you would like to discuss your application. Thank you so much for joining us today. I hope that all of your questions were answered during the event, but if you still have questions, you can always ask us by calling 1-800-641-5641 or emailing us at admissions@uws.edu. We're going to end this event with a campus tour by Caitlin and Taya. Have a wonderful day. We hope to see you soon.
Hi, my name is Taya, and I'm a chiropractic student here at University of Western States. Currently, I'm standing outside of the admissions office here located at our new campus in East Portland.
And I'm Caitlin, also a Doctor of Chiropractic student, as well as a sports medicine master's student. As Taya mentioned, we're here in East Portland at our new campus, which is located around a bunch of great amenities. There's a lot of green walking space, including walking trails, a golf course. We're also located next to public transportation, such as the Max line, as well as there's a bus stop right outside.
As Caitlin mentioned, there's tons of great stuff just located around our new campus, and we'd love to show you around. We are currently in one of our adjusting rooms. This room can be made small or it can be made large depending on the class size. We have brand new features of this room, brand new tables, brand new technology used for our professors and our teaching assistants to help us with hands-on skills ready for us in classes. We've got models and skeletons ready to use so that we can be the best chiropractors we can be.
We're here in the Student Assessment Center where we have 16 different rooms where you can work with standardized patients. Working with standardized patients is such an invaluable opportunity because you can hone in on your patient history as well as communication skills before you move on to the next step into the clinic.
Here on the second floor is the business office. They'll help you with tuition and payment plans, and also the registrar office is located here as well. They'll help you with enrollment and cohort changes. Again, if you need anything with business or registrar, this is where you'll come.
We're standing out here in front of our campus store where you can get everything that you need as a student. They've got snacks and sandwiches as well as all the UWS apparel, and you can get group discounts on things like chiropractic tables and speeder boards and all the tools that you need as a student. There's also a much needed Spinal Tap, which is a full service coffee shop where we get our beans from a local coffee place so that you can get your lattes and coffee and tea. Really, the campus store is where you can get anything that you need as a student.
Here we are in the NCMIC Fitness Center, which is 4,000 square feet of new equipment, including bikes, treadmills, free weights, and squat racks. We also have a locker room with daily lockers and showers made available. Overall, this is a great space to get a workout in.
We're here in Mountain Hood, which is our largest lecture hall on campus. You'll spend most of your first year taking classes in this room, such as anatomy, neurophysiology, and the history of chiropractic. This room is great because it has brand new technology as well as movable furniture for breakout sessions. It's a wonderful learning environment.
Here on the first floor of the campus, you'll find the Uws Library. You'll have textbooks, artificial and real bone models, and the friendly library staff will help you with all your study needs, like renting iPads, headphones, whiteboards, and happy lights. Here in the back of the library, we have computers that you can utilize. You also have booths, standing tables, and you have 2 private rooms for individual and group studies. As you can see, there's lots of space that you can utilize here.
We're really lucky at our new campus to have this meditation room where you can come and relax throughout the day. Our architect was wonderful to go ahead and dedicate his artwork to help create a nice mindful space.
Right now, we are here in the testing center, which is located inside the student services. Student services will provide testing accommodations to those who need it. You can also go to the student services if you need tutoring, counseling, or anything like that, like club information. They're there to help you out.
As a student, it's really important to have a good, quiet study space. Here at our new campus, we have 1,800 square feet dedicated just for that. There's a lot of different variety of seating choices. We've got couches, as well as standing options, and private study cubicles. So whether you come here by yourself or with a group, it's a great place to get work done.
Here at UWS, we have 2 health centers. We have the Campus Health Center, and we also have the Health Stream Center. When you reach quarter 8 of the chiropractic program, you'll enter into the Campus Health Center. You will work directly with a licensed clinician, and you will work on chiropractic care, rehabilitation, and nutritional counseling. The Health Stream Center is a community-based internship led by Dr. Bill Morrow. Upper quarter students have the opportunity to work in the center to solidify their skills as a chiropractor.
Now we're here in the standard process student commons, where there's a lot of indoor and outdoor seating, as well as the campus store, so students can kind of come together and study, meet up with friends. There's also a lot of microwaves, which as a student I'm very excited about. So the student commons is just a great place to get together, whether you're studying or it's in between classes. Thanks so much for joining us on the tour of our brand new campus. If you have any questions, feel free to reach out to an admission advisor.
Or you can reach out to a student ambassador like us.
Thanks again for watching, and we hope to see you around campus soon.